My name is Rachel Bradshaw, and I'm the director of the training program in genetic counseling at Washington University School of Medicine. I also provide clinical services as a prenatal genetic counselor at the St. Louis Fetal Care Institute at Cardinal Glennon.
Awesome. What is the general role of a genetic counselor?
Genetic counselors are master's trained professionals who help patients understand what their genetic risks are. They may explain what types of tests would make sense for them. They may help interpret test results. They can go through family histories to help determine if other family members are at risk. And they also help other healthcare professionals understand how genetics may play a role in their patients' medical histories.
Thank you. What kind of practice settings do genetic counselors work in?
Genetic counselors primarily work in three settings. They work primarily in the cancer, prenatal, and pediatric settings. However, in the last several years, we've seen an expansion of the types of clinical spaces that genetic counselors occupy, including things like cardiology, neurology, adult medicine, even just kind of sort of wellness medicine too, as we understand more about how genetics plays a role in even common diseases. And beyond clinical practice, a lot of genetic counselors can be found working in industry, so they may work for genetic testing laboratories, helping clients, ordering physicians understand what tests are appropriate for their patients, how to interpret test results they get back. They may help write test results, lab reports, or they may kind of work as liaisons between physicians and the lab to help develop the next set of tests that would be best for their patients.
Thank you. What is your specialization, and what does your day-to-day work look like at your practice site?
So I've always been in the prenatal setting, and specifically in the last several years, I have focused on the setting of fetal care, which is a specialized type of prenatal care where you take care of pregnancies that have known anomalies. Sometimes they're relatively minor, maybe something like a cleft lip or something that may not require a lot of intervention or may not be particularly medically complicated for a baby, and sometimes we follow babies that have much more complex diagnoses, whether those be known genetic diagnoses or just a collection of complex birth defects. The fetal care model is really a multidisciplinary model, so it's very much focused on interprofessional practice. So what typically happens for our patients when they come into our fetal care center is they sort of get what we call a concierge service, meaning that all the specialists come to them. So they are able to certainly get an ultrasound and meet with a maternal fetal medicine doctor, but beyond that they also get a chance to meet with other specialists that may have expertise about their baby's particular medical story, or may be able to help them cope with the types of things that they're dealing with as they understand this diagnosis in their baby. So our patients will meet with often me, the genetic counselor, but also our social worker. We have a palliative care team if we have babies that may have particular illness or a life-limiting illness, to kind of help families understand how to cope with that and make plans for their baby's arrival. And we also make sure that they meet with some of the other pediatric specialists who may be taking care of their baby after birth. So if there's a known heart defect, they may meet with a cardiac surgeon or another pediatric surgeon if it's a non-cardiac defect that may need surgery.
Perfect. Well, thank you so much for meeting with me and doing this today.
Thank you.